Hello, this is Dr. David Green, Education Director for Premier Pain Specialists in Chicago. Today's topic is the basics of kyphoplasty for vertebral compression fractures. Over 700,000 compression fractures occur every year in the spine. Most of these are due to osteoporosis, and a lot of them actually go unnoticed because there's no pain. Half of women and 25% of men will have an osteoporotic fracture in his or her lifetime, and once a compression fracture occurs, the risk of additional fractures in the adjacent vertebrae goes up fivefold. Symptoms of a compression fracture may include a sudden onset of back pain. It could be back pain that worsens while standing or walking, limited spinal mobility, maybe height loss, deformity, and/or disability, or a person may have no symptoms, like I mentioned. Here's the downward spiral. You start with spinal fractures, which leads to back pain. Can be some deformity if you get multiple fractures in a row. The person can be leaning forward, called kyphosis. This can pinch on the lungs and impair breathing. It can impinge on the stomach and impair appetite. It can cause sleeping problems due to the pain, decreased activity, which can lead to worse osteoporosis, more increase of fracture, and then it just spirals on and leads to a 23% increase in mortality. So what are the treatment options? Well, if it's not really painful and it's not really hurting, then you can kind of just watch it and neglect it. That's called benign neglect. Medications can be helpful. This may include over-the-counter medications like non-steroidal anti-inflammatories, Tylenol, maybe some short-term narcotics and muscle relaxers, and then bracing. The brace that you see here is called a Jewett brace. It has points of compression around the abdomen, over the chest, and then in the back. So 3 points of compression. The vertebroplasty procedure was invented in the 1980s, at that time for treatment of fractures due to cancer. And then it actually crossed over into osteoporotic fractures about a decade later. It's an outpatient, low-risk procedure that provides instant pain relief. The catheter goes through the pedicle here, avoids the spinal canal, and injects cement. You can do it unilateral or bilateral. And it just, as soon as the catheter goes in, the cement's injected, and you get immense pain relief. The kyphoplasty procedure is an evolution of the vertebroplasty procedure. It was FDA cleared in the late 90s, and it really became popular about 5 years after that. It's similar to a vertebroplasty, but it does involve insertion of a balloon first. So here's the procedure. You insert the tools into the fracture. You can see the fractures here. The catheter goes in. Then it inflates this balloon with saline, and you can actually see it because it has dye in it. And then once that's satisfactory, you deflate it and then puts bone cement in that void. And then the bone cement hardens in about 20 minutes. Well, what are the outcomes? Usually a person has immediate pain relief from that stabilization. It's like an internal splint. The aches and the spasms may continue for a few weeks, but most of the pain resolves right away. Over 90% of patients see dramatic pain relief with significantly increased function, such as walking and performing activities of daily living. There have been some studies showing questionable benefit, but they are far outnumbered by the ones that showed incredible pain relief. The top non-operative pain management in the greater Chicago area is with Premier Pain Specialists. There are several clinics throughout the metropolitan region, accepting over 50 insurances and providing over 25 treatment options. Amazing success rates with the board-certified, fellowship-trained, award-winning doctors. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you very much for watching today.